Hi, Galaxy family. My name is CJ. I'm an occupational therapy student at Wayne State. So, during this current coronavirus pandemic, our day to day life has been quite challenging. And I know a lot of questions have been coming up. Like, what is the coronavirus? How can we lower our exposure to it? And when should we actually go to the emergency room? So, to answer these questions, I have Dr. Amanda Aquino, an ER physician from Detroit, to provide useful information to keep us safe and provide support to our Galaxy community. So thank you for coming, Dr. Aquino.
Hi, CJ. Thank you for having me.
So the first question I do have to ask is, what is the coronavirus? And it's also known as COVID-19.
Yes. So the coronavirus is a virus that affects the body, and it causes certain symptoms such as fever, dry cough, all over body aches, and in some serious cases, a hard time breathing. The main body system that the coronavirus affects is our lungs. And it's actually called a pandemic because unfortunately, currently people all over the world are suffering from this infection.
Wow. So how does this virus spread from person to person?
This virus is actually very contagious. It is spread by droplets. And when we say droplets, it means that when a person who's infected coughs or sneezes, these droplets or saliva water particles are released into the air. And these particles can stay in the air for quite some time. And these particles also, fall and land on many surfaces. And so unfortunately, if another person walks by into the air and gets into contact with these particles or touches any of these surfaces that have these particles on them and then touches their face, that is unfortunately a very easy way of contracting this virus.
Oh, so it's pretty easy to catch.
Mm-hmm.
So what can we do to protect ourselves?
Definitely a good question. So the main thing that we need to go back to is the basics. Protect yourself by hand washing. Wash your hands with soap and water for 20 seconds. Count to 20 if you have to, because that is the most effective way of cleaning your hands. The average person touches their face over 100 times a day. And the way the virus can enter our bodies is through our eyes, our nose, and our mouth. And so on our day-to-day lives, we're constantly touching many surfaces, coughing, sneezing, walking around, and we constantly come into contact with these particles. So we always have to be more mindful and wash our hands after we go out in public, touch dirty surfaces, use the bathroom to make sure that our hands are clean so we don't touch our face.
Okay. All right. So I know that hand sanitizer is actually pretty useful as well.
Oh, yeah, definitely. To use that on the go, for sure.
Right. So with hand sanitizer, I know that's a problem because there's a national shortage amongst other things. But for hand sanitizer, I found a homemade recipe to actually make that at home.
Oh, wow.
Yeah, so you just need 3 ingredients. All you basically need is rubbing alcohol. You also need aloe vera gel and essential oils, or you can just use lemon juice. So you just need 3/4 cup of the rubbing alcohol. You need a 1/4 cup of the aloe vera gel, and then just 10 drops of the oil, or you can use lemon juice. Mix it in a bowl until it's a gel form, and then you just put it into a bottle, and there you go.
That's definitely a good way to use home or local ingredients to make a hand sanitizer. That's definitely just as effective because rubbing alcohol is 99% proof and very effective in killing germs.
Yeah. So I know that you mentioned earlier that the virus is spread through droplets when we cough or sneeze. So my next question would be to ask about homemade masks. Are they beneficial?
Absolutely. So like I said, when we cough or sneeze, these respiratory droplets are set off into the air and can land on surfaces. What a homemade cloth mask can do is essentially serve as a barrier. When you cover your nose and mouth with these cloth masks, it can protect you from releasing your particles up into the air and also prevent you from coming into contact from these particles as well. So I think definitely having a homemade mask is beneficial, especially in these times.
Oh, I see.
And I see that you have some.
I do, right here. So all you have to do is just get an elastic band. It goes right over your ears here. You can sew it together, and it just covers your nose and mouth. And if, let's say, you don't have access to that, you can also use a bandana. I pre-folded it here into a triangle, and it just goes over your nose and mouth. You just tie it in the back, and instant face mask right there.
I definitely have to add, though, that if you're using homemade masks, you definitely want to wash them frequently, because just using one cloth mask for days and days and days, those can definitely get affected from the droplets that you come into contact with. So you want to make sure that you wash them frequently.
Okay, good advice. So what do we do if, let's say, we do get sick, doctor?
Great question. So the first thing you need to do is to not panic and don't worry. A majority of patients are able to successfully recover at home without any complication. Now, I brought with me some items, key items that most of us have in our homes, and if not, are pretty easy to access in our grocery stores or drugstores. So if we do get sick, the first thing you need to make sure is to make sure you're fully hydrated. I have a Gatorade bottle here, especially my favorite flavor, but you definitely need to make sure you drink lots of liquid, whether it be Gatorade, water. You want to make sure you're staying hydrated because our body definitely needs fluids to fight off the infection. And speaking of infection, the next thing to have is a thermometer. This is a forehead thermometer, but it measures your temperature. Anything above 100.4 is a true fever. And the coronavirus can definitely cause high fevers, even as high as 103, 104. But not to worry. You just need to make sure that you keep your fever down. And I brought some Tylenol here. It's a basic medicine that you can get over the counter and take it as directed on the label. But definitely this helps with your temperature and keeping it down, and also helps with pain. And the next thing to look out for is if your illness does get a bit more severe. I have something here called a pulse oximeter. This is a handheld device that you can put on your finger, and it measures your heart rate and your oxygen level. And a normal oxygen level is anything above 95%. Anything less than 95%, you see this, and you're having some trouble breathing, I definitely recommend you call your doctor and always have your doctor's phone number on hand.
Okay. And we can purchase that online as well if you can't find it at the pharmacy. So great advice, great information. Thank you for that. So I know that you work currently on the front lines and you see a lot of patients that have tested positive and you treated them. So what are some of the concerns that they've expressed to you?
So a big concern for anybody really is that this coronavirus is a brand new virus. We do not have a lot of information, and information is changing every day. And unfortunately, there is no cure, there is no medication, there is no proper plan that we know of that will successfully cure this virus. So the main thing is to really have a support system with you, know the basics on how to treat your fevers and stay hydrated, and first and foremost, know that you have to stay home, because the last thing you want to do if you're infected is to go out into the public, to grocery stores, outside, to urgent cares or hospitals, and possibly infect other populations who are more vulnerable, such as our elderly, our disabled, or people who have chronic medical conditions who don't have a strong enough immune system to fight this.
So speaking of vulnerable populations, you mentioned individuals with either physical or neurological disabilities. This whole change in their routine, as well as having to rely on technology and then being self-isolated, can be even more challenging.
I can definitely imagine that, for sure.
So what I wanted to ask, from your perspective, what advice would you give to those individuals, and what can we do to better support them?
That is an awesome question. It's unfortunate because in the emergency department, I all too often encounter patients with neurologic disabilities or any disability that prevents them from properly being able to communicate how they're feeling, pertinent information, and sometimes are even alone without an advocate with them. And so my first piece of advice is to come up with a pre-written or pre-printed health action plan, meaning that it should be a basic document that contains pertinent information, such as your medical history, your allergies, a list of your medications, the name of your doctor. And also what's important is 2 phone numbers of 1 or 2 people that can advocate for you, who we can call, who can provide much more information.
That's great.
Yeah, and honestly, the second piece of advice that I would offer is, especially for these patients, is to have a support group, whether it be a family member, a friend, or a caregiver, just someone who can call the patients daily, check in on them, see how they're doing, see if they need anything such as an errand, or just someone to talk to. Because especially during these times where things are very uncertain, it is always good to have someone to always check in, to provide that support for our community.
It's great advice. So again, I want to thank you, Dr. Aquino, for providing all this useful information.
Thank you so much for having me.
Yeah. And also, if you want any further information or resources, please check the Galaxy website. There's a lot of great things that can help you out during this time. And just know, be safe, and just know that we're all in this together.